Good morning, everyone. Happy Monday morning. Can we say happy? Is Monday happy? Monday. I'm Steve,
I'm Scott.
and together we're Backyard Musings, broadcasting from the People's Republic of California.
Yep, and it is a beautiful day, and we got planes flying in the sky,
NSA.
and we are talking science and technology today.
Yes, sir. This is a good one.
Yeah.
A routine, low-cost heart test may be on the verge of a transformative upgrade thanks to artificial intelligence. How many stories have we done on artificial intelligence?
Yeah.
Especially in the health industry.
Just within the last 6 to 8 months.
Yeah. With advancement in artificial intelligence, a common and affordable test used in many medical clinics could soon help uncover hidden heart conditions. Structural heart disease, which includes problems like valve defects and congenital abnormalities that interfere with how the heart functions, affects millions across the globe. Unfortunately, because no cost-effective screening method exists, these conditions often go unnoticed until they begin to cause serious damage. These researchers' findings are discussed in the journal Nature on July 16, 2025. Would you like to know more?
Okay, this is something we all like to talk about, right? Quote, we have colonoscopies.
We do.
We have mammograms.
We do.
Well, not we, but people do. But we have no equivalents for most forms of heart disease, says Pierre Elias, assistant professor of medicine and biomedical informatics at Columbia University, Vagelos College of Physicians and Surgeons, and medical director for artificial intelligence at New York Presbyterian Hospital, I believe, right? That's a hospital.
Mm-hmm.
To address this gap, Elias and a team of researchers from Columbia University and New York Presbyterian created an AI-based tool called EchoNext.
Nice.
Yeah. The system examines data from standard electrocardiograms, ECGs, to determine which patients might benefit from a follow-up ultrasound. A non-invasive imaging test that can reveal structural heart issues. ECG.
EchoNext was able to detect structural heart disease from ECG data more reliably than cardiologists, even those who had access to AI-assisted interpretation. That makes the humans look dumb, right? Quote.
Well.
Right? EchoNext basically uses the cheaper test to figure out who needs the more expensive ultrasound, says Elias, who led the study. It detects diseases cardiologists can't from an ECG. We think that ECG plus AI has the potential to create an entirely new screening paradigm. Love it.
The ECG is the most used cardiac test in healthcare. The test, which measures electrical activity in the heart, is typically used to detect abnormal heart rhythms, blocked coronary arteries, and prior heart attack. ECGs are inexpensive, non-invasive, and often administered to patients who are being treated for conditions unrelated to structural heart disease.
Now, have you seen that little device that they sell that you can wirelessly link to your phone, and you put two fingers on it, and then it gives you an ECG, electrocardiogram, right there? You haven't seen that?
No.
As seen on TV?
I have not.
Yeah, that's how common they are.
Okay.
While ECGs have their uses, they also have limitations. Quote, we were all taught in medical school, of course, that you can't detect structural heart disease from an electrocardiogram. We all know that, right? Elias says.
Okay.
Echocardiograms, which use ultrasound to obtain images of the heart, can be used to definitively diagnose valve disease, cardiomyopathy, pulmonary hypertension, and other structural heart problems that require medication or surgical treatment.
EchoNext was designed to analyze ordinary ECG data to determine whether follow-up with a cardiac ultrasound is warranted. The deep learning model was trained on more than 1.2 million ECG echocardiogram pairs from 230,000 patients.
Nice.
Yeah, it's a lot.
Yeah.
In a validation study across 4 hospital systems, including several New York Presbyterian campuses, the screening tool demonstrated high accuracy in identifying structural heart problems, including heart failure due to cardiomyopathy, valve disease, pulmonary hypertension, and severe thickening of the heart. I'm not familiar with that.
Well, that's
Thickening
so.
of the heart.
Well, so you don't want your heart broken, so you get a thickened heart, right? You don't want that heart broken.
Okay.
Okay. In a head-to-head comparison with 13 cardiologists on 3,200 ECGs, EchoNext accurately identifies 77% of structural heart problems. In contrast, cardiologists making a diagnosis with the ECG data had an accuracy of 64%. And I suppose that varies on their level of expertise, how many years they've been doing it. To see how well the tool worked in the real world, the research team ran EchoNext in nearly 85,000 patients undergoing ECG who had not previously had an echocardiogram. The AI tool identified more than 7,500 individuals, that's almost 10%, as high risk for having undiagnosed structural heart disease. The researchers then followed the patients over the course of the year to see how many were diagnosed with structural heart disease. The patient's physicians were not aware of the EchoNext deployment, so they were not influenced by its predictions.
Among the individuals deemed high risk by EchoNext, 55% went on to have their first echocardiogram. Of those, nearly 3/4 were diagnosed with structural heart disease, twice the rate of positivity when compared to all people having their first echocardiogram without the benefit of AI.
These planes are annoying, man. They're just flying circles.
It's
Practicing. Yeah. At the same positivity rate, if all the patients identified by EchoNext had high risk, had an electrocardiogram, about 2,000 additional patients may have been diagnosed with a potentially serious structural heart problem. Quote, you can't treat the patient you don't know about, Elias says. Using our technology, we may be able to turn the estimated 400 million ECGs that will be performed worldwide this year into 400 million chances to screen for structural heart disease and potentially deliver life-saving treatment at the most opportune time, Elias says.
Nice. Right, yeah, that's good. Yeah. Elias and his team released a de-identified data set to help other health systems improve screening for heart disease. The researchers have also launched a clinical trial to test EchoNext across 8 emergency departments. So,
okay, folks, EchoNext.
Yeah.
When you go in and get your heart looked at, ask for EchoNext.
Yeah, and pretty soon it'll be available on Amazon.
Maybe AI.
You buy one and you can just do it at home.
Yeah. Well, EchoNext is the AI program.
Right.
Yeah.
You don't think you can buy it on Amazon?
I don't think so. I think the doctor's proprietary.
You can buy anything on Amazon. You can buy a car on Amazon.
With money. If you got the money, right?
Right.
All right, folks.
Take care, everyone.
We'll see you in the afternoon.
That's not a plug for Amazon, by the way.